Drug abuse. That is our today's topic. What is addiction? Addiction is a disease that affects your brain and behavior. When you are addicted to drugs, you cannot resist the urge to use them, no matter how much harm the drugs cause you. Drug addiction isn't about just heroin, cocaine, or other illegal drugs. You can get addicted to alcohol, nicotine, opioids, painkillers, sleep, and anti anxiety medications, and other legal substances as well. For example, many people are addicted to coke, many people are addicted to tea, many people are addicted to coffee. So, the legal things can also, you can be addicted to legal things as well. Drug abuse. So, what is drug abuse? Drug is abused when you use legal or illegal substance in ways you should not. You might take more than the regular dose of pills or use someone else's prescription. You may abuse drug to feel good, ease, stress, or avoid reality. But usually, you are able to change your unhealthy habits or stop using altogether. Types of drugs. There are many types of drugs, but the four drugs that are in our syllabus are stimulants, opioids, depressants, and hallucinogens. Stimulants or uppers. They are also known as uppers. Why they are known as uppers, I will tell you. Impact the body in central nervous system, causing the user to feel as if they are speeding up. So they make you feel speeding up. That is why they are known as uppers. These drugs increase the user's level of alertness, pumping the heart rate, blood pressure, breathing, and blood glucose level. Stimulants often come in pill form, but they are also consumed while snorting or even as food or drink. For example, caffeine is found in many beverages, for example, Coca-Cola and all that. And cocaine is a powder that is snorted. So you can snort it, you can drink it. Caffeine is also present in coffee, in your tea. So these are the examples of how stimulants can be taken. Risk of stimulant abuse. When abused, stimulants can cause a variety of undesirable consequences. These effects can include anxiety, high body temperature, depression, heart failure, and stroke. Opioids. The next type of drugs that we are going to study is opioids. Opioids are powerful painkillers that produce a sense of euphoria in users. Derived from the poppy plant, opioids are often prescribed by doctors to patients who are suffering from intense pain. So, most of the drugs are obtained from the poppy plant. They are extremely habit forming, sometimes even causing addiction is in as little as 3 days. So, they are very much addictive. How can we take opioids? Opioids can be smoked, even drunk, injected, or taken as pills. For example, opioids include heroin, morphine, hydrocodone, and opium. Risk of opioid abuse. Opioid abuse can devastate the life of user. Unfortunately, when someone decides to stop using opioids, they suffer tremendously then as well. For example, hydrocodone. Withdrawal can be especially nasty. Riddling suffers with flu-like symptoms for weeks on end. Other effects include constipation, liver damage, brain impairment, drowsiness, sedation, pupil dilation, cardiac arrest if dose is too high. Depressant. The next type is depressant. Like stimulant, depressants also impact the body's central nervous system, but in the opposite effect. With the opposite effect, making user feel as if things are slowing down. So stimulants speed up the things, depressants slow down the things. They're also known as drowners on the street. Doctors prescribe some depressant for anxiety, insomnia, which is a sleeping sickness, obsessive compulsive disorder, and other medical issues that prevent the sufferer from fully relaxing. These drugs often offer a sedative experience to user, so they are also sedatives, making them a tempting choice for teens who wish to escape everyday stress. Alcohol as a depressant. Alcohol acts as a depressant, making it popular choice for the users looking to relax. Although drinking is often associated with immediate burst of energy after a sip, overdosing of alcohol can cause severe toxicity and even death. We have discussed alcohol in detail in our last video. Tobacco as a depressant. The active ingredient in tobacco is nicotine, a chemical that acts as both a stimulant and a depressant. Tobacco gives user a minor immediate rush followed by a feeling of relaxation. Nicotine is one of the most sedative substances known to man and is dangerous for your teen and even dry. Risk of depressant abuse. The depressant can be useful when used properly, but depressant abuse can cause a host issue in both the long term and the short term. The high risk of high blood sugar, diabetes, and weight gain, increased body temperature, sluggish thinking, low blood pressure, impaired memory, hallucinations, and death from the withdrawal. These are some side effects. Hallucinogens. Hallucinogens are called class of drugs that cause hallucinations, profound distortion in the person's perception of reality. So the person start imagining things. Hallucinogens can be found in some plants and mushrooms, or their extracts, or can be man-made. While the exact mechanism by which the hallucinogens and dissociative drugs cause their effect are not yet clearly understood, research suggests that they work at least partially by temporarily disturbing the communication between the neurotransmitter system throughout the brain and the spinal cord that regulate mood, sensory reception, perceptions, sleep, hunger, body temperature, sexual behavior, and muscle control. Risk of hallucinogen abuse. Hallucinogen abuse can be devastating effect that can last a lifetime. Hallucinogen persisting perception or disorder is known as flashbacks. Fear, anxiety, increased blood pressure, and nausea. The drug example we are going to study is heroin. Heroin is an illegal, highly addictive drug processed by morphine, a naturally occurring substance extracted from the seed pod of certain varieties of poppy plants. So, as I've told you, from poppy plants, most of the drugs are derived. It is typically sold as a white or a brownish powder that is cut with sugar, starch, powdered milk, or quinine. Highly pure heroin can be snorted or smoked, or may be more appealing to new users because it eliminates the stigma associated with injection drug use. The black tar heroin is sticky like roofing tar and hard like coal. How heroin is used? Many people smoke or snort heroin. Most of the users inject it into their veins. That's the most dangerous way to take it because it's easier to overdose and can catch a disease from the dirty needle, that is AIDS. No matter how you take it, the heroines get into your brain quickly, so it's a very quick addictive drug. It is also easy to get addicted. Even after you use it once or two times, it can be hard to stop using it again. Right after you take heroin, you get a rush of good feelings and happiness. Then, for several hours, you feel as if the world is slowed down. You think slowly and may walk slowly. Heroin blocks your body from getting pain messages and slows your heart rate and breathing. If you overdose, you may stop breathing or die. Many people start using heroin to deal with the anxiety, worries, and other stresses. One of studies shows that 75% of the users had mental health and issues such as depression, ADHD, and bipolar disorder. What are the effects of heroin? Short-term effects of heroin include euphoria, which means that you will feel very excited, a dry mouth, warm, flushed skin, arms and legs that feel heavy, upset stomach and vomiting, itching, a fizzy brain, switching in and out of drowsiness, which is that is being also called on the knot. Long-term heroin can lead to collapse pain, insomnia, which is sleeping sickness, infection of your heart lining and walls, skin infections like epilepsy and cellulitis. Bases are big pimples and cellulitis in disease in which your skin become reddish and become itchy. and swells, a higher chance of getting HIV/AIDS, hepatitis B and hepatitis C, liver and kidney disease, mental disorders, lung diseases like pneumonia and tuberculosis, menstruation problem, and miscarriage. So, what are the withdrawal symptoms of heroin? Jitters, chills, vomiting and diarrhea, bone and muscle pain, trouble sleeping, cold flashes, leg movement that you cannot control. Heroin addiction and treatment. Your medical team can help you find the treatment plan that works best for you. If it will probably include medication and behavioral therapy. Experts may say this medication is assisted treatment MAT is the gold standard of care for people who have heroin addiction. Hope you have understood the topic. See you soon.